In 2009, in conjunction with the spin-off project SimiChild, Healthy Child's grid network was extended to include the Johns Hopkins University Hospital in Baltimore in the United States. Let's listen to Alan Everett, the lead cardiologist from the Johns Hopkins University, about his institution's joining Healthy Child.
I'm Alan Everett from the United States, and the Healthy Child project is I think a unique innovation because children are really data orphans in what it takes to develop new ways to treat the problems that we have. It's also kind of a new environment that actually links the best clinical centers to develop the new and best methods of care. It's been very difficult for us in North America to be able to link with our colleagues in Europe to work together to solve problems, and the Healthy Child really offers a new model to be able to do that. And the infrastructure that's being developed kind of allows us to think about how to do new things in new ways. We're really honored to be able to be involved with the European institutions to share in developing a new project called SimiChild, which we really believe kind of sets a new paradigm and really sets a new standard for how we can develop new therapies for patients with better care, better safety, and really find new ways to tackle problems that we really never had a way to get at. And I think the collaboration and the cooperation that has got started as the Healthy Child Project and continuing on to SimiChild and others is just really kind of the start and the spark to really kind of set the model for the future. So I'm very happy to participate in it, and couldn't think of a better group to work with than the team that's involved with Healthy Child.
Tom Miller, Chief Executive Officer of the Workflow and Solutions Divisions of Siemens Healthcare Sector, sums up concisely Healthy Child's 4 years of work.
Problems in pediatric medicine are very challenging. The disease incidence is often very rare, complexity very high, and the centers of excellence very few. Healthy Child has proven that by connecting centers of excellence in a common platform, some of these challenges can indeed be tackled.
As a temporary conclusion to the Healthy Child story, let's listen also to Yannis Ioannidis, the head of the Information Science Department of the University of Athens, on how to position the work of Healthy Child within the framework of e-health and of clinical ICT, and on where future developments may lead.
The three pillars that we see and we have seen and tried in Healthy Child have been models and simulations as a subset of achieving the virtual physiological human, decision support, where we try for specific cases having a patient or a healthy person in front of us to see what is the right decision for them, and analysis and prediction, knowledge discovery, data mining, when we look into all cases. Now, these, in order to work, all three of these require massive and extensive amounts of information. And not only they require that to begin with, when you put them into motion, then they generate significant amounts of information. So it's a circle that starts from lots of data and generates more and more of data. You saw a whole bunch of zeros in a number that Giacomo pointed later. To do this, to handle this, therefore, you need intelligent information management. One of the things that Healthy Child didn't do and is required is what I said, that there's a huge diversity of information that is out there and needs to be harnessed and put into one place, not just patient data, but a whole bunch of other things for education, for decision support, and knowledge discovery. A whole bunch of things to be done is essentially what we need is to create a digital library, a digital repository of all the relevant clinical data for a particular disease or multiple diseases in order to achieve this. Curating the data is a very important problem because it's not just cleaning up, oh, a value is missing here or not, but it's semantic curation as well. It's massive and coming in streams, and how do you extract the right of information in an automatic way from imaging, for example, or from text descriptions? And also there are purely techie stuff that we need to be worrying about. One big thing is going from grids to clouds. A cloud is a evolution of the grid, if you want, and it offers really economy of scale, and we need to be worrying about this, plus improving our services.